Hello all, I, Dr. Subhango Chakroborty from Kolkata, would be talking about a very common habit seen among children, that is, thumb or finger sucking. Thumb sucking or non-nutritive sucking habit is any kind of finger sucking which persists after 4 years of age of the child. These habits form a serious threat to the developing orofacial structure. The onset of this habit is sometimes even before birth. Hence, these habits should be discouraged and discontinued as early as possible. Now, what would happen if you let the thumb sucking habit continue with your child? It would lead to protruding teeth and short upper and lower jaw bases. It will lead to a dull, unattractive face which might have deep-seated psychological and emotional effects on the child. It may also lead to speech and pronunciation issues, and perhaps the greatest concern with the thumb sucking habit is that it predisposes the child to become a child with disturbed sleep and breathing. Hence, the child might be a future snorer. Now, how to break this habit? Firstly, the child has to be convinced that this habit will have a deleterious effect on his face and teeth. Once the child is taken into confidence and is willing to give up the habit, a few of the home remedies may be tried. It is always advocated to have a dental visit for this child. The dentist can help reverse the changes which has been caused by this habit. A few home remedies which can be tried, which include a hand puppet or a thumb cap which is manifested as a puppet. This will help the child to not suck the thumb and henceforth discourage him to do so in the future. It is sometimes useful to make the child sleep in his father's or some adult's shirt so that it is difficult to find the thumb through the sleeves. This is particularly useful for those children who suck their thumbs during their sleep. It is very useful to monitor the progress of the child and reward him accordingly. It must be remembered that the child should not be bribed into discouraging this habit rather than rewarded for not practicing the habit for a considerable number of days. So, do all children develop thumb sucking habit? No, child with adequate feeding history almost never sucks their thumb. Generally, thumb suckers have a prolonged bottle feeding history. Also, studies have revealed that absence of parents for a long time leads to deep security concerns within the child. This predisposes the child into sucking his or her thumb. Parents always remember the child might not be at the fault in sucking his or her thumb. There might be underlying issues which might predispose him in doing so. Hence, it is always better to be delicate with the child. They say old habits die hard. Hence, it is very useful to catch this habit young and correct it early. On this note, this is Dr. Subhango Chakroborty from Kolkata signing off. Have a very good day ahead.